Canyon Transitional Rehabilitation Center provides the ideal environment for physical rehabilitation and healing to help you get back to life. And the center's administrator, Ginger Howard, and director of nursing, Rebecca Vigil, join me this morning with more information. Welcome, ladies. Thank you for joining us. So, Ginger, I wanted to ask you, what makes the Canyon the ideal setting for rehabilitation?
Well, as we discussed last time I was here, Canyon is a facility that offers skilled nursing and therapy services, primarily for 5 different initiatives. One is for wound care, trach care, someone who's had CVA and might be weakened and they need that kind of therapy. Someone who might have gone in the hospital and got weakened from like pneumonia. And of course then we do that strengthening and that nursing care for those who've had ortho replacements.
Right, which a number of my family members have gone through, so I know all about that recovery, yes.
And so I brought Rebecca today so that we could talk a little bit more about our nursing services and how that supports the system.
Great, well yeah, let's actually talk about that. So Rebecca, what in terms of comparing it to, like, say, a standard hospital, what kinds of treatment, what makes it different and what sets you all apart, and what can we expect differently than what we would get at a normal hospital?
Well, it's definitely a different level of care. In a hospital, clients have more intense, individualized, 24/7, there's somebody there always. As in our facility, there is 24/7 care. But we are helping people transition from the hospital to home, and so we provide more supportive care to help them regain their independence for their transition home.
Right, and that can, I mean, you know, that can be a big transition if someone doesn't have services like a rehabilitation center, going from a hospital to the home. That can be a big step. So the staff obviously needs to have a little bit more specialized training. So can we talk a little bit about the training that you all provide to your staff in order to facilitate this care to the patients?
Yes, we have a great therapy team that works with our CNAs and our nurses to train them for clients who have individual care needs, people who have hemiparesis, which is one side paresis from a stroke, or having to assist people who have had a knee replacement. We seek educators, people to educate our staff to learn how to take care of tracheostomies, to doing labs and x-rays, and we're able to do that kind of care in our facility.
Yeah, and it seems that having that really sort of specialized, close support is something, obviously, we don't get a lot in hospitals, just in this day and age with the hustle and bustle. So having something like this, it seems just absolutely invaluable. Like you said, for folks that are coming out of a hospital and needing that really specialized care.
Plus the fact we've been expanding our specialties, and so as we have someone come in that really has a unique situation that kind of requires some, we seek training from our partners in the community, like Kindred, or we seek extra training, like she said, from our therapy department. Some of our vendors have specialized wound treatment care and treatment stuff, so we participate in all that so that we can make sure that the care that we give is individualized to the point that they can get home. And
that's great. That's fantastic. It's so important. Now, folks that are watching at home, if they want to contact you about the services that you offer, or say maybe they want to seek employment with you, how do they go about doing that? And for folks that are potentially looking, it may be becoming part of your team, what characteristics do you look for?
So Rebecca, what do you look for in a teammate?
Well, they definitely have to be a person that likes to work in a fast-paced environment that is constantly changing, because we do assist clients with a wide range of medical and surgical diagnoses. And so we definitely have to want that constant change and be able to assist and know all the different aspects of different conditions.
And how can we contact you for more information?
We're at 101 Lagriма de Oro. We're at the corner close to Eubank and Montgomery. So they can certainly come by. We encourage people to come by to do tours if like you think you're going to have surgery or you might need us. We encourage you to come by if you think you might want to be employed with us. We do
Great.
have a certain employment system that we go through. The first thing is to come in and to fill out an application, and then as openings happen and the managers then can look at those applications. So we do have a system for that.
Great.
But it was a good chance for Rebecca to talk about that, our fast pace and our intensity. And so if someone's looking for that kind of opportunity with the nursing team, please come by and see us.
Absolutely. Fantastic. Well, ladies, thank you for joining me this morning. Really
Thank you.
appreciate the information.
All right, thank you.
All right, thank you.